This is HealthAfrik on AAU TV. If you just tuned in, on this episode, we are talking about spinal stenosis with Dr. Jerome K, Korle-Bu Teaching Hospital in Accra, Ghana. You can follow the discussion on our social media handles at Association of African Universities on Facebook and YouTube. On the first segment, we looked at the introduction of spinal stenosis. On this segment, we are going to look at the diagnosis and treatment of this disease. Doctor, you're welcome back to HealthAfrik. All right, so moving on to the diagnosis and treatment. Before we ended the first segment, you made mention of some symptoms. So I want to know, when I experience these symptoms, when should I see a doctor? And then what diagnosis method are you going to use to treat, to look at me or to...
So most people, aging comes with back pain and neck pain because of the wear and tear in the spine. So most people start to complain about pain or discomfort in the back, in the neck or thoracic region or the spine basically, or the lower lumbar region. And the pain sometimes shoots into the legs. And the first area of presentation is the local doctor. And if it's mild, mostly an active life, physical therapy, and occasional painkillers. This is not a pain popping disease. But the problem is that if the pain continues, people then will be tempted to continue taking painkillers for too long.
Okay.
And our painkillers, especially the non-steroidal anti-inflammatory drugs, called the NSAIDs, they have the effects on the joints and the kidneys and can actually give you permanent damage to your kidneys and your joints. So you want to avoid those prolonged medication as much as possible. Some people take over the counter, but it should be limited. If you take your usual paracetamol, which works surprisingly for a short while, and it doesn't work in your case, then you move on to see your primary care person. It could be your local nurse or nurse practitioner or doctor or physician specialist. And then when they evaluate, basically the first thing they want to do is an x-ray.
Okay.
Just to be sure that you don't have some broken bones or some tumor leaking away somewhere, or some bone erosion, some serious disease, which are the red flags. Because in the beginning, it's just exercises and painkillers. But if it's a serious bone disease, you don't want to go to that direction, because by the time you realize you are paralyzed.
Okay.
So it's important to rule out the red flags, which will cause you paralysis, which is the tumors, maybe spine infections, instability, and other things that may cause you paralysis. So these are the things you want to do. And basically, it's a doctor or the nurse or the person trained in this area that will detect it. And if it's not severe, usually the x-ray is adequate. Okay. If it's persistent, and especially you have some weakness in your arm, or your handwriting is changed, you are dropping cap splits and things, then we know there's pressure on your spinal column and your nerve root. So they may ask for tests or some spine scans that gives you more details. Okay. So in addition to the x-ray, they may ask you to do an MRI, magnetic resonance imaging of your spine, and or a CT scan. But it depends on, we can't go and do a scan of your whole spine. So if they evaluate and see it's restricted to your neck, they'll do it in that region alone. I know some people feel they are rich, so they just walk in and do a scan of their whole spine. It's not helpful. The most important thing is to diagnose and be sure that there's nothing dangerous that's going to get you paralyzed. Okay. That's the most important thing. So X-ray, the early treatment and management is the physical therapy, exercises, positioning, work ethics. Basically, those are the main things. Weight reduction. Okay. And this doesn't help.
All right.
Saves you a lot of headache. And if it goes beyond that, then the doctor comes in. Sometimes when it gets to the intermediate level and there's a lot of pain, apart from the painkillers that we give, we also can do some injections in the spine that helps bring the pain down. Makes you more comfortable. Surgical intervention is the last resort. Another helpful procedure is chiropractor.
Okay.
So they help in doing the manipulation and the massage in the spine and help improve the back pain. But they don't cure you. So you have to understand the limitations of whatever procedure you are doing. So if you're going to a chiropractor and it's 2 months, 3 months, and the pain is still there, it's not going, you need to go to your doctor.
Okay.
And then they will evaluate you.
Right. During my research, I came across that there's a difference between the diagnosis method and then the differential diagnosis. Now, what are the differential diagnoses for spinal stenosis?
Okay, if we say differential diagnosis, what you're trying to say is what are the other disease conditions that resemble what you are dealing with, the spinal stenosis.
All right, so doctor, moving on to the treatment, you've already made mention of physical therapy, medications, and then surgery as a later part. Now, can you tell us more on this treatment, more on the physical, more on the medications, and then the surgery, any side effects?
Okay, so starting with basically the increased activity. We've known that increased activity helps in improving back pain instead of a sedentary lifestyle. That's one. Two, we also noticed that massage and physical therapy also helps in improving back pain. We try to explain it through what happens is that the body's natural mechanisms. When you move your limbs and you move your spine, your bodies release their own natural morphine substances. We call them endorphins. And they help in controlling pain in your body. So we think that this is how it works. And including chiropractor, including acupuncture, and including massage. So the activity, jogging, brisk walking, and physical activity also improves this. So they help in relieving your back pain and in slowing down your progression. But to say that they will cure your back, well, I don't think so. It just slows it down. Unless you want to ask me whether I can decrease your age for you. As you grow, these things happen. So you can't reverse it, but you can slow it down. So that's about the physical therapy. Chiropractor, massage, acupuncture, and increased activity. So that's the way it works. And these are really helps in treating the early onset and intermediate level of spinal stenosis. But if it's severe, that means that it starts to compress on the cord end or the nerve roots and gives you a lot of damage to the spinal cord and the nerve roots. And this damage is what brings about the weakness and the paralysis in a severe form. In the beginning, it is pure weakness and the damage is reversible, but with time it becomes permanent. So if you have a degree of paralysis and weakness, if it's evaluated early and the pressure on the cord is taken out, then there's a good chance that you'll recover well. If you wait too long, then it becomes permanent. And the weakness, as I described earlier on, is basically if it's your arm, you notice your arms are heavier and maybe you can't lift them up as much as you could. Depends on the level of the muscle groups, and or your handwriting has changed. You drop objects, cup splits, you drop them, and then you can't lift. Maybe you have kids, you can't lift them up. And if it involves your lower extremities, you notice that you can't walk far. You walk for a little while, and your legs feel heavier, as you're about to fall. And then sometimes you have pain and numbness in your leg. Occasionally you have burning sensation, a pain anytime you walk. So those are the signs and symptoms. The other disease condition that can give you pain in your legs.
Yeah,
so, I mean, just injury to your leg or injury to the nerve itself can give you pain. But so you have to be sure which one you are dealing with and not mix things up.
Now, still on a surgery, what actually do you do? Are you taking out a bone or you are expanding the? What actually do you do?
So basically, all we do is we look at where the pressure is on the spinal cord and relieve the pressure. So we take the pressure off the spinal cord without causing instability of the spine. So whatever you do, the pressure on the spinal cord and on the nerve needs to be relieved. And then at the same time, make sure that you don't cause paralysis, you don't cause weakness, or you don't cause instability where your spinal column is loose, hodger like that. You don't do that. So in surgery, you can do it from the back or from the front or from the side. Depends on your expertise and the degree of narrowing. But the most common part is that we work from the back. Most common. But you can work from any direction. And the main aim is to take either part of the bone or some extent of the bone and go into the canal and free the spinal cord. And the degree at which you do depends on the level of narrowing or stenosis that you get.
Now, I'd like to know the recovering period after surgery.
Oh, okay. So usually, if it's just a small narrowing, so there's a way we can do it, as we call minimally invasive, where you do small incisions and use telescopes and you go in and you drill off the bone or shave off the thing that's causing the narrowing. And usually about the following day or within 72 hours you're out of the hospital. But if it is extensive, then you have to do an open surgery. And that one usually, the maximum stay in the hospital is usually about 1 week. And then you go out of the hospital. Not making you worse than you are. So usually you go home with a cane or a walker. Within 2 weeks, you should be fine back to work. Occasionally we do something we call spinal fusion, where if there is already instability in the spine, that means there's excessive motion in the spine from the degenerative changes or things that cause a narrowing. Or by your action, maybe the way you have to do the surgery to cause instability, we try to join the bone together. We don't join the whole spine. There's a limited fusion. So you do the decompression and put screws in, and you lay bone, and the bone will end up growing to join together. You just limit the spine movement just a little bit, but in general, you can live your normal life. You know, Tiger Woods has done about 8 surgeries in his back. He still plays golf.
Wow.
So that's the example I give to a lot of people.
I'd like to know the side effects after surgery.
I think that's on the low side. I mean, now, you see, there's a lot of ideas that are carried from the earlier on. We did not have like good imaging. We don't have MRI, we didn't have CT scan. You have back pain, they say let's go and open and see. So they don't know whether it's a tumor you have there or some injury or something permanent. So they say 50-50. Nowadays, it's not like that. We can do scan and know exactly what is happening in your spine. We can predict exactly what can happen to you. So it's no longer 50-50. So the idea that if you do your spine and your surgery in your back, that is no longer tentative. It's not correct. It's not a correct diagnosis. If you have tumor in your back and it's causing you paralysis, if I look at the extent of paralysis, I can tell you this one will become permanent. So the general talk is no longer tentative. You have to do the scan so that we know exactly what is there. We can then advise you on exact things you're going to do. Exact thing. But the idea that you do surgery on somebody and then you know and be what it is not correct. I mean, as I said earlier, Tiger Woods had done 8 surgeries. He's playing golf. He's not in a wheelchair.
So let's say I come to you and then you prescribe surgery to me. What should I do to prepare myself before I come for the surgery?
So you have to know exactly what is worrying you. In addition to the spinal stenosis, is there any instability? Okay. Is there any permanent damage to the cord, which we overlooked? And all this will inform you of one, the surgery we are going to do will relieve your back pain, but will it stop? Are you already at the irreversible stage or are you at a reversible stage? Okay. That's one important thing you need to ask. You need to ask whether the weakness you are having, is it going to get be the same? Is it going to get worse? Because we also noticed that even though you come in severe state and we say we'll stop it, in about 10% of people, they get worse whether you do surgery or not, because they are already in a reversible stage, a damage stage. So it's important to know what is happening exactly, and then the doctor will advise you on what he's going to do, what he cannot do, and then you can plan with your family what you want to go ahead with. But now it's crystal clear about what you can do and what you cannot do. Okay. So it's not like before we didn't have the images, so we don't know what is there before you get in. Now we know before you get in.
So you're going to do the exact thing?
Yes.
All right. Now, so after the surgery, what post-care activities are you going to prescribe for me?
So after the surgery, mainly we want to take care of your back pain.
Yeah.
Because you've cut through your muscle and your nerves. Not the nerves, you cut through the muscle and some bone. So give you painkillers to control the pain, acute pain, till it heals. Within 2 weeks, the pain is all gone. And then you may have some aches there and there. We give you some things to cover. Post-op, we also give you support, maybe back support, so that you don't twist or bend to give you too much. And then we give you off duty to not be too active. Okay. But after all this, when it heals, the aim is to bring you back to your normal daily activity, so you can go back to work.
Right.
And people do not want to work again anyway, but that's on the light side. But the aim of the surgery is to restore your normal activity so you can go back to work.
Okay. Now, to end this segment, my last question is, what preventive measures can you tell somebody in case, like just to prevent yourself from getting spinal stenosis? Okay,
so the next question I also ask you is, what preventive measures can you take or do to prevent your aging?
Okay, there's no preventive measures.
So then it's something that comes. Okay. But you can delay it. Okay. You can also delay your severity. Okay. If I say you can delay it, you can't delay your aging.
Yeah, that's true.
But you can delay the aging on your body by being more active. Okay. And then if you are getting moderate to severe symptoms, you present it early so they don't get permanent damage to your spinal cord or your nerves.
This is the end of the second segment where we looked at the diagnosis and treatment of spinal stenosis.